Welcome back, dear viewers, to my YouTube channel for the discussion of Roman medicine part 2. So, today we are diving into the incredible world of Roman medical history, especially the brilliant contributions of two ancient pioneers, Aulus Cornelius Celsus and Soranus. These names might not ring a bell right away, but after today, you will definitely see how their work still echoes in modern medicine. So let's see the contributions of Aulus Cornelius Celsus, the Roman encyclopedist. Celsus wasn't a doctor per se, but he was a brilliant Roman encyclopedist. He had knowledge of agriculture, law, philosophy, military science, rhetoric, medicine. The name of the general encyclopedia of his treatises is De Artibus, and the medical content about surgery, various diseases, drugs, accurate diagnosis. The treatises in the book, the name is De Medicina, which has 8 volumes. Thus, De Medicina was one of the earliest major medical texts, and it was printed way back in 1478. He was the first person to clearly define the four cardinal signs of inflammation: rubor, dolor, calor, and tumor. That is redness, pain, heat, and swelling, respectively. Is it familiar to you? Yes, we all know the signs of inflammation. That is straight from ancient Rome, the famous encyclopedist Celsus. He discussed the management of wounds by methods of arresting bleeding by compressed pressure on vessels, suturing wounds edges with thread. He discussed the management of fractures by immobilizations of fractured limb by splints, bandages stiffened by wax, floor, paste. That is the his book Encyclopedia De Medicina, where the treatises on the medical field are written. So Celsus, the name of the book is De Medicina. These are the surgical instruments he used for various surgeries, cataract, and setting the fractures. Thus, for compound fractures, he advised excision of protruding bone segment. His descriptions of surgical procedures were advanced and precise. He described plastic surgical procedures of nose, ears, lips, and restoration of prepuce in circumcised male. He prescribed numerous surgical instruments and like probes, hooks, forceps of various types. So dentistry was also present in ancient Roman times. Celsus discussed oral hygiene. He talked about stabilizing loose teeth, jaw fractures, and even teething pain. Some even call him the first dental surgeon or keeper of the teeth. That's pretty amazing for someone writing in the 1st century AD. Now we discuss the contributions of Soranus. He has the names like Father of Gynecology, obstetrics, and even pediatrics. He came to Rome from Ephesus via Alexandria. He came 100 years after Celsus. So he is recognized as a gynecologist, an obstetrician, and pediatrician, a woman doctor of ancient Rome. His book Magnum Opus was on diseases of women, a standard book for 15 centuries. Thus, Soranus, father of gynecology, he wrote on midwives, his descriptions on menstruation, contraception. He was quite ahead of his time in advocating against abortions by mechanical means. He described female genital organs, wrote on midwives, described podiatric virgins, breastfeeding, and even weaning. He noted that amenorrhea in pregnancy could be physiological and in breastfeeding, or it could be caused by inflammation of genital tract or in debilitating illnesses. He wrote on contraception by the insertion of cotton or ointments, but advised against abortion by mechanical means. Thus, he is also recognized as father of obstetrics. He paid great attention to difficulties in childbirth due to maternal deformities like contracted pelvis or problems involving fetal size and position. So today's term of CPD, we are well aware of it. He described various abnormal fetal positions, various methods to correct them. He advised hooks, forceps to extract fetus. So this picture of fetal positions is available in his book. He detailed the care of newborns, teething issues, weaning methods, making him an early pediatrician, as I already said before. He wrote extensively on care of newborn child, advised on weaning, on the teething problems and childhood problems too. Thus, the legacy of ancient Rome is continued by Celsus and Soranus. So, isn't it fascinating, the contributions of Celsus and Soranus, where their contributions marked a important milestone in the Roman medical history. Thank you.